Good afternoon. Today is Tuesday, December 1st. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me today is Diane Oldenburg, Senior Public Health Educator for the Oswego County Health Department. I hope you had a peaceful and healthy Thanksgiving. I want to start out by thanking our health department, first responders, and essential employees who worked during the Thanksgiving weekend tracking COVID patients, taking information for investigations, and doing their jobs to make our community safe. Over the Thanksgiving weekend, the county received an additional 242 positive test results. All these patients and their close contacts are followed up on. Although we have been preparing for this surge for months, it is having a staggering effect on our public health system. Employees from other departments have stepped up to help share the important work of the health department in tracking cases, managing records, and other aspects of the COVID pandemic. Our county COVID response team met virtually this morning, and I am in frequent conferences with the regional control room discussing the spread of the virus, the need for personal protective equipment, the capacity of our healthcare facilities, and other issues. Unfortunately, as the number of cases increase, the reality is that we will see increased hospitalizations and increased number of deaths attributed to COVID. We remain in close contact with Oswego Health and other providers to manage the demands on our resources and healthcare system. I want to take a few minutes to address some of the misconceptions that have been circulating on social media. From time to time, there are discrepancies between the number of positive cases or the number of deaths reported by the county and the state health departments. This is often the result of delays in information reported to us by the state, people being hospitalized in other counties or similar situations. It is very important to us that the county provide the most accurate and up-to-date information as possible. Unfortunately, these discrepancies sometimes cause speculation that someone is being less than truthful. I can assure you this is not the case. There is no value for anyone to hide important information of this nature. That said, we will always do what is necessary to protect the privacy of our residents while sharing with you the relevant data you need to make informed decisions about your personal safety. The County Health Department does not report a COVID-related death until they have received the medical examiner's report and a death certificate. Each person's death is a loss in our community. We share in the family's grief, and we have no reason to hide or minimize this information. The governor has identified small gatherings as the number one spreader of COVID-19, with at least 65% of all cases coming from these settings. In Oswego County, the health department also attributes the failure of people to properly isolate or quarantine as a factor in local spread of the virus. If you or your child has been placed in isolation or quarantine, it's vitally important that you follow the rules and guidelines of the health department. Likewise, if you have been tested for COVID and are waiting for your results, you should remain quarantined until you receive your test results. The point is to keep the virus from spreading to others, and this includes people in your own household. I have asked Diane to discuss this in more detail in our health department report. Currently, our 7-day rolling average of people who tested positive for COVID in Oswego County is 5.7%. That is up significantly from last week, as we would expect. And Diane is here to share some more information.
Thank you, Chairman Weatherup. There are now more than 1,000 people who are either in mandatory isolation because they've tested positive for COVID or quarantined because they might have been exposed to COVID through close contact with a positive patient. We realize that being in isolation or quarantine, especially if you don't have symptoms, can be an inconvenience at the least and a hardship for many people. But as Chairman Weatherup stated, the purpose of these regulations is to keep the virus from spreading to others. Isolation or quarantine are not voluntary. They are orders enforced by public health law. If you are placed in quarantine, you should stay home for 14 days after your last contact with a person who has COVID-19. If you live with someone who tested positive for COVID and you can't avoid continued close contact, you need to stay in quarantine for 14 days after the person meets the criteria to end home isolation. During this time, you should watch for fever of 100.4 degrees or higher, cough, headache, loss of taste or smell, back or muscle pain, fatigue, shortness of breath, and other symptoms of COVID-19. You should stay away from others, especially people who are at higher risk for getting very sick from COVID-19. It's very important that parents make sure their children are following isolation and quarantine orders as well. There's more information on the cdc.gov website and our health department's COVID-19 page at health.oswegocounty.com/COVID-19. As of today, we've had 81,853 tests performed. We have 1,965 positive cases. We have a total of 442 active positive cases. We've had 1,518 patients released from isolation. We've had 5 deaths related to COVID-19. We've received a total of 79,643 negative test results, and we have 1,260 residents in mandatory quarantine or isolation. Another way that people can do their part to help curb the spread of COVID is to download the state's new app called COVID Alert New York. COVID Alert New York is a voluntary, anonymous smartphone app. People who download the app receive an alert if they were in close contact with someone who tests positive for COVID-19. The app is anonymous. It does not track your location, but instead uses Bluetooth technology to sense when another person with the same app comes within 6 feet. Your phone exchanges a secure code with the other phone to record that they were near. The more people who download COVID Alert NY, the more effective it would be. For more information, visit coronavirus.health.ny/COVID-alert-NY. Thank you.
Thank you, Diane. We ask residents to continue to monitor reliable sources of information. Go to OswegoCounty.com or health.oswegocounty.com COVID-19 for the latest news release and updates, or call the Health Department's COVID hotline at 315-349-3330 weekdays between 8:30 a.m. and 4 p.m. All of us need to work together to help prevent this pandemic from becoming dramatically worse. Please keep yourself safe and take personal protective actions so we can avoid additional restrictions and future shutdowns. Thank you for doing your part.